The arm it's like a balloon, but again, this is one of the long balloons. It just happens to have a couple joints in it. Joint on either end. I want you to also notice that the arm is like a short leg with more dexterous toes. Okay? So all of the stuff I'm about to show you with the arm, we can immediately adapt it to working on the legs. Okay? There are going to be some interesting things with the legs that we will get to tomorrow that will complement this, but I don't want you to differentiate too much between arm and leg for a lot of this stuff, because conceptually the basics are going to hold true for both. Okay? So for you it's been more elbow and down, correct?
Yes.
Okay.
Yep.
All right. So if I'm going to just kind of gently palpate. Okay. Not a big deal along there. Not a big deal along there. Okay. So once in a while, and I start further away, partly because she's gone through some stuff around the wrist and the hand, but also sometimes people do have some stuff a little proximal that they don't realize till we poke at it. Okay, so I'm going to kind of check around the elbow a little bit more thoroughly. Not a big deal there. And I'm not poking super hard, but just kind of checking some of the common flexor tendons, common extensor tendons, all that good stuff. Okay, not too bad. And I'm also paying attention, she's not making any faces. So either she's got a good, you know, a good poker face, thank you, or that, or it's not really bugging her. So we're going to come down into the, kind of explore through the flexors here. Not too bad there. Okay, brachioradialis. Again, muscles as landmarks rather than as targets. Okay, I'm going to support her hand here so that I can kind of check along the extensors. Not too bad there. Okay, so when I come along in this area here in your forearm, that's not too bad. But you were describing that you've been having a lot of tension.
Yeah, it's deeper in the brachioradialis.
Okay, so up to this point, I've been using, you know, at most moderate levels of pressure, not a whole lot. But you're talking about, like, if I get, you know, more aggressive with it, then we start finding it. Now, the interesting thing to me is that when I actually grab the brachioradialis, it actually wiggles around pretty easily. So either you've relaxed a fair amount already, or I have to get quite a bit more aggressive with how I palpate there. That's not too bad though, is it? Okay. All right. So either you're having a good day, or it's not actually that bad at the moment.
Last week.
Okay.
Yeah,
So it's possible that it's just not an awful day, and there might be another day where she shows up and it's just rock hard. Okay. So so I'm going to take a moment. I'm going to go through a couple things, just kind of going through the motion, for demonstration purposes, and then I'm going to come down to this area here where you've been having more consistent discomfort. Okay. So if it's anywhere along the arm or around the elbow, forearm, and so forth, a couple different things that are going to be real familiar to you at this point. Balloon technique. Okay, a lot of people, they may have something in their bicep, so I'll take my hand, get a grip on the opposite side of the arm. And again, balloon technique, drawing the skin away from that spot. Most of the time, give it a couple seconds again, check in. Usually it's going to be quite a bit different. Sometimes if I add a little positioning, you know, to shorten that area with a little strain counter, strain type movement, that might work well. And there's no reason why I can't combine strain counter, strain type movement with a balloon technique. Okay, so we can put slack into the muscle and still tension the skin at the surface. Does that make sense? Okay. So we can certainly combine things. Another thing that might be familiar, her arm is stretched out straight. That means that her bicep is being lengthened. Okay, that also means that if I stretch the surface longitudinally up and down her arm, okay, now we're getting a little stretch all the way up and down your arm, all the way down to those deeper layers of muscle. Okay, that might be something that she tolerates very well. If she doesn't tolerate that well, again, I can put a little bend in her elbow, but I can still stretch the superficial skin. Okay. Another option is that if she doesn't tolerate that stretching very well, I can gather the skin, do the opposite of the stretch. Okay, so now we're getting not only slack way deep down, but also slack on the surface. Okay. Another option. Remember that shearing that we did earlier. Okay. What if I just hold her arm on either side. Could be upper arm. More often I'll find myself using it on the lower arm. And go ahead and just let your arm just kind of flop there for the moment. Okay. And what I might do is on one hand, I'll get a grip on one side of the arm, and on the other hand, I'll get the other grip. I'll get a grip on the other side of the forearm. And what Diane has noticed, and what seems to hold true in most of my practice, is that the hand that's on the thumb side, I'm going to draw the skin down on that side. The hand that's on the other side, on the pinky side, I'm going to draw the skin up. So now I'm moving everything in between. Okay? And a lot of times,
you're just grabbing the layers of skin that you're not concerned about whether or not you're grabbing or tractioning any muscle with that.
Correct.
Okay.
Not worried about any muscles or joints, other than I want her arm and hand to feel safe in this position. Okay? But I'm just moving the skin in opposite directions on either side of the forearm. A lot of times people will feel a sense of relaxation, warming, a whole lot of other, pleasant adjectives might be used. Okay? So some people really like this a lot. Sometimes you're just going to feel a softening or warming of the tissues in your, between your hands. And the nice thing is that, it shouldn't be aggravating at all. Okay. Now with that idea, we can also get more specific. We can also go down by the wrist. So So at first I move my hands down here, and this is the area where she said she's occasionally has some concern, and it's not always conscious concern.
Right.
Because that I'm not going to do anything awful to your wrist.
Right.
But that doesn't mean your autonomic nervous system isn't still going to be on guard, right?
Mm-hmm.
Okay. So your amygdala and all that stuff is still kind of like, fuck. Don't let him do it. Okay. So at first I just come down here and I just give her a chance to feel like I'm just gonna hold it and support it. And now and I felt her relax a little bit more.
Mm-hmm.
So now see where my hands are at? Now one of my hands is gonna move up towards her medial elbow, and one hand is gonna draw down on the thumb side. And I'm just gonna do that slight change. So it doesn't feel like much of a change to her, other than I was just holding her and supporting her hand. Now I'm just slightly shifted my position, but not in a threatening way.
Mm-hmm.
Okay. Does that feel helpful to you at all?
Yeah.
Okay. All right. So, and this is the sort of thing where if a person's gone through this kind of stuff, I'm not usually going to start poking around that spot where they had this traumatic thing happen. At first, I just want them to feel like I want their body to just let me touch them and gently manipulate the area without it being a big deal. Okay, because her conscious brain is fine with it, but it's that wild animal in the primitive brain, that lizard brain. I want that to trust me and trust what I'm doing. Okay, and the beautiful thing is that as I've maintained it, her wrist is allowing me to take it just ever so gently further, and so so far not a big deal. Okay. Any discomfort at all?
No.
Oh, good.
Can't feel the stretch.
Okay. Does that stretch feel uncomfortable for you?
No, feels good.
Okay. Is that an area that you normally stretch as part of your therapy? Okay. You kind of gave it a funny look. Like, do you avoid that stretching that area?
I massage it, but it's like the sensory nerves are just starting to come back a little. I was completely numb on my hand, and it was a creepy feeling.
Okay. Cool. So that's it's.
You apply it a little.
Just a little bit. This hand right here is gently gently moving her skin up towards her armpit.
Okay.
And this hand out here is gently drawing down on the thumb side of things. So when I first contacted, I'm going to come out slowly. You can see how much she moved because I started off with her in a neutral position. But just by taking our time, her body allowed me to take it into about 20 degrees of medial adduction. Okay.
The fingers also cold and relaxed and more so.
Okay, so this is the sort of thing where I don't always get to work on people that have gone through stuff like this, where it was pretty traumatic and where there's guarding and stuff like that. But I do see it often enough where I've just found that I really need to slow down, and I just need to think in terms of okay, at first do nothing, and just let the body just relax and just let it trust you. Okay, and again, if it's, think of it like a wild animal. Okay, she might consciously trust you, but that doesn't mean that her deeper layers of her nervous system are going to trust you yet. So, does it come down to here? Is that okay? Okay. So it's the area around your wrist, though. That's the area that's been giving you the most grief, and mainly on this side, correct? Yeah.
Actually, it is both sides. I'm not gonna lie.
Okay. So from here now, if I gently touch around your wrist, how does that feel?
It's okay.
Okay. As I come around.
That feels great. That's usually really sore.
Okay. And as I